Smoking has a proven negative effect on the health of pregnant women and their babies. Pregnant women continue to smoke despite the known harms for a variety of reasons. In their social circles, smoking may be considered so normal that it's hard to imagine a different way of operating. Smoking is of course very addictive. Some women will be genuinely unaware of the harm that it causes. The maternity care team, including midwives and their assistants, are in a very good position to support pregnant smokers to quit because they'll see them on many occasions throughout their pregnancy. Midwives accept that offering stop smoking advice and help are an integral part of their role, but unless they're given the necessary training and tools, they can be concerned about damaging their professional relationships with pregnant women. In the northeast of England, the amount of women smoking at the time their baby was delivered was 20% higher than the national average. After detailed work with women and midwives, Fresh Smoke Free North East, with support from the Strategic Health Authority, commissioned a package of measures known as Babyclear. This was to be rolled out across the North East. Its purpose was to systematically embed NICE guidance and define clear referral pathways to stop smoking in pregnancy services. After training on positive ways to approach the issue with women, midwives were provided with carbon monoxide monitors to screen all women at each appointment. Women with raised carbon monoxide were referred for a specialist support to stop smoking in pregnancy services. Because it is considered so important, pregnant smokers had to specifically opt out if they didn't want to be followed up intensively. Stop smoking in pregnancy services then followed up with appointments, smoking cessation advice and treatments, and made sure that the take-up was reported back to midwives, closing the information loop to make sure people didn't get lost in the system. For pregnant women who were still smoking at the time of their dating scan, a more intense risk perception intervention was offered in some units, using a computer and a fetal doll, allowing the mother to see the true negative effects that smoking can have on her unborn baby. Some women can find the facts quite shocking, but most are glad that they've been informed and come to expect this as part of their routine antenatal care. The package proved successful. Even prior to including the risk perception intervention, referral rates to stop smoking in pregnancy services increased progressively and were soon around 2.5 times higher than before. Quit rates amongst pregnant women almost doubled and were even higher in mothers who set a quit date. Smoking causes low birth weight, which puts babies at risk of complications. In this study, babies born to women who quit smoking during their pregnancy were on average 6% heavier than babies whose mothers smoked. In fact, they weighed nearly the same as babies whose mothers had never smoked, so the effects of smoking can be reversed by quitting and equals an additional healthy 200 grams for a baby born at term. The training of all frontline staff was vital preparation for implementing NICE guidance and has allowed midwives to make challenging smoking into a maternity service norm. CO monitoring acted as a strong motivator to quit, and although it was sometimes hard to achieve, cross-agency working between midwifery and stop smoking in pregnancy services was critical. Most women accepted the need for a hard-hitting approach, and those who struggled to quit valued the more intense follow-up.